My name is Patrick Buchanan. I'm a pain physician. I practice in Camarillo, California. As a PM&R doctor, I really have a focus on SI joint dysfunction. So at the time, I just had the lateral fusion technique. The advantages of the minimally invasive posterior, especially with the LinQ procedure, it's a quicker recovery time. When you're in there, you don't have to be under general anesthesia. All these LinQ procedures can be done under conscious sedation. And then just the ease of accessing that joint. As pain physicians, we're already trained to do a posterior injection, so it kind of fits our skill set as well. And then also, it reduces a lot of the complication risks. So for the lateral approach, you have to go through tissue, muscle, and then you have to be careful that you're not going through the sacrum or any of the nerve roots there. With the posterior approach, it's just basically skin. You go right into the SI fusion, so they have quicker recovery time. They can be weight bearing as tolerated, and patients seem to be happier with the results. I had a lot of success early on with this procedure. Patients, not only that they feel better and their pain is better, but they also say functionally they can walk better. They can do more things, they can do more activities. It's easier for them to, do the laundry or wash the dishes or, play with their kids. So not only just from a pain perspective, but also from a functionality standpoint, this procedure has really had a lot of success with my patients. I can be with my patient through the whole treatment process, from physical therapy to the diagnostic blocks, and then to mechanically fixing and stabilizing the joint with the SI joint fusion. So I get to be there, with them through the process and see how they, improve at each step along the way. The very first guy I did in California, he was pretty obese. He had a BMI of over 40. When he came in, he was in, debilitating back pain. Couldn't really walk, couldn't do anything. And it was my first SI joint fusion using the LinQ. And literally right afterwards, he did amazing, 100% relief. He was able to do the activities he wants to do. He's losing weight. And I've been seeing him for a couple years after, and he's still doing fantastic. So we as physicians, data is the ultimate importance to us. That's how we base our decision making. That's how, payers, approve these. And ultimately, this is how we validate our success and how we improve patient outcomes. So data is super incredibly important to me. In terms of how, I think PainTEQ partnering with them has been so important because they are really in it for the right reasons. They're in it to gather this data in this space, this emerging space, to really help benefit the SI joint space in general, and also improving patient outcomes. They've been very supportive. Like I said, they really care about, they're building this from the physicians on up, really listening to us and getting our opinions on how to move this therapy forward. So they've been very good at, kind of putting their money where their mouth is. So investing in training, investing in research, which is paramount to our field, because that's what we based all our decision making on.